So thanks for the introduction. I'm going to present a very brief overview of a few current initiatives of the Bone and Joint Strategic Clinical Network that you might have heard rumors about, or you may wish to know more about. And we won't be speaking about any of them in depth. The objective for this morning is just to bring them to your attention and point you in the right direction should you wish to have any additional information. So disclaimers, and my disclaimers are noted. Neither my musical or comedy career is advanced enough to have any additional sources of income. I do work for clinical services for Alberta Health Services, as well as committee stipends from a number of organizations that you might represent, that you might recognize. So if you're new to Alberta, or even if you aren't new to Alberta, you may not even know or have heard of what a strategic clinical network is. So that's actually a good place to start. The key point here is that the strategic clinical networks are in fact networks which support innovation and new program development, but are not the programs themselves, although some programs will operate with ongoing strategic clinical network involvement and support. The existing strategic clinical networks are listed on the left side of this page, and on the right side are the various provincial programs, and one of those is the Primary Healthcare Integration Network. Bone and Joint Health Strategic Clinical Network was the first, and its first project was the integrated hip and knee osteoarthritis surgical programs province-wide that you may have had some experience with. The mission and vision of the Bone and Joint Strategic Clinical Network are described as follows. AHS's primary vehicle to promote bone and joint health, working to transform the way MSK health care is delivered for Albertans, and the Keeping Albertans Moving goal by providing the highest quality bone and joint care, ensuring community has access to the care at the right time and by the right provider. For those interested, the 5-year plan called the Transformational Roadmap is described here and can be found on the Bone and Joint SCN website. It was, of course, developed pre-COVID, and so those timelines have certainly been impacted. The illustration on the right side describes using measures such as mitigation, mending, and maximizing function to promote bone health, joint health, movement, and function in order to keep Albertans moving. Which brings us to the topics we're going to cover briefly today, and these include the shoulder pathway, the osteoarthritis comprehensive care standards. I'm going to touch very briefly on an update on GLAD and fragility and stability. So the Strategic Clinical Network supported the development of an integrated shoulder care pathway that we expect to see widely implemented in Alberta to help standardize the assessment and management of shoulder problems, both non-surgical and surgical in nature. It is being piloted by a number of primary care networks at present, including St. Albert Sturgeon PCN, as well as specialty clinics in the Edmonton, Calgary, and Lethbridge regions. Over time, it's expected to become more widely recognized and implemented across the province. The pathway development process and the final product were published last year in BMC Family Practice, and the link is provided for you there. The final product as a pathway is now available on the Alberta Health Services website, as seen on this slide, and the illustrated links will take you to the pathway or to a short one-page summary of the pathway. I'm not going to go into the pathway in detail. I just wanted to point out some features, including the summary page that describes how the primary care assessment starts with a focused history and physical examination, with identification of red flags ruled out, differentiating shoulder from related neck region problems, and classification into one of these three categories that are down on the lower right. Those being rotator cuff disease, biceps pathology, labral pathology is one class. Second class being adhesive capsulitis and shoulder arthritis, and the third class being shoulder instability pathways. This is just an example of the level of detail that the next several sections go into. There are about 12 sections and subsections, as well as an appendix that describes and illustrates the shoulder special maneuver tests for those of us that can't remember them all. And this one-pager provides a very high-level summary of how the various sections interplay, and I'm sure you probably can't see that anyway. Okay, the second topic I want to briefly touch on are the hip and knee osteoarthritis conservative care pathways and care standards. I've had the privilege of helping steer the development of these documents as co-chair of the Osteoarthritis Conservative Care Working Group for the Strategic Clinical Network, and the pathway has been in operation as a pilot site in Lethbridge, comparing outcomes with Red Deer. I'd hoped to be able to present more detail on the quality care standards, which have been finalized. Unfortunately, the goal of putting them on a website has been a casualty of COVID-related redirection of SCN resources, and I don't have a final timeline of when they would be widely available. In the interim, on this slide, you'll find a link to some of the limited resources that can be found on the Alberta Health Services Healthier Together website. This is a screenshot of the Healthier Together website. That's an introduction to some of those resources that we've talked about. And this is an introduction to the quality care standards. I'll just point out that the Alberta Bone and Joint Health Institute is an arm's length organization, actually separate from the SCN, but it acts as a foundation which does fundraising to support initiatives of the Strategic Clinical Network. And this is a high-level introduction to the 9 standards that are incorporated into the overall document. When you will find it hopefully soon on our website. These include Standard 1 clinical assessment, developing a care plan, tailoring treatments. The core treatments are recognized as osteoarthritis education, exercise and physical activity, and weight management. And then rounding out the osteoarthritis journey with adjunct treatments, including pharmacotherapy, appropriate referrals for joint surgery, and then Standard 9 is the ongoing evaluation and quality of care measurement and feedback. A related initiative of the Strategic Clinical Network is supporting the rollout of the GLAD program, GLAD standing for Good Living with Osteoarthritis Denmark, which is where the original program was developed and validated. It's an education and structured exercise in group program specific for hip and knee osteoarthritis that typically is provided over 6 weeks. It is being widely incorporated into community physiotherapy and other sites, including some primary care network sites across Canada and particularly in Alberta. It can now be accessed in approximately 73 public or private sites across Alberta, and under COVID has also been adapted for virtual delivery. Upcoming initiatives are listed here with respect to GLAD. To support further rollout and further research outcomes in collaboration with the National Oversight Group. Finally, a brief note about the fracture liaison service, which has been operating in many hospitals to identify patients who present with an osteoporosis-related fragility fracture, particularly hip, and ensure that they're directed to ongoing management to lower the risks of future fractures. It's being rolled out to more sites in the coming months, and you may, if you're working in a smaller center hospital, you may learn more about it in the weeks and months ahead. As noted, the FLS, Fracture Liaison Service, is now operational in Medicine Hat, and patient transfers between zones is being facilitated. So if a patient from Medicine Hat shows up in a Calgary hospital, then the appropriate communications are going back and forth to make sure that coverage isn't dropped. future initiatives may look at additional high-risk fractures besides the hip. And finally, a brief glance at a future vision in which the Alberta Bone and Joint Health Institute is supporting a map to motion, which in a stepwise modular fashion will develop clinical pathways for all those conditions you see listed, including others and others again at the bottom. The shoulder module on the top left is completed. That's the one we talked about today. The soft tissue knee module is at 80% completion, and the back and spine module is at 20% completion. So stay tuned for future updates and learning how you can incorporate those into your community. So that's it in a nutshell. Hopefully you now have a bit better understanding of what a strategic clinical network is, how they can have an impact on your practice, some examples from our Bone and Joint Health SCN. It's been a very brief and high-level introduction, and please do reach out to me or directly to the Strategic Clinical Network or the Bone and Joint Health Institute if you'd like any further information. And I think we're going to be moving into question session quite shortly.